Okay, your time starts now.
All right.
Your time has
Hello,
started.
I'm Dr. Tamanna, one of the duty doctor here. Nice to meet you. How may I address you?
My name is Jane.
Okay, Jane. How can I help you today?
Doctor, I've been having this abdominal discomfort for the past few weeks, and it's just been bothering me a lot.
Can you please tell me more about what do you mean by discomfort? Do you feel pain, or is there any
Yeah, it's like,
um
yeah, it's pain. You can say it's pain.
okay, okay. Do you have any pain now?
No, I'm okay, thank you.
Okay. On a scale of 1 to 10, can you please describe the pain for me?
It's about 5, 6.
Okay. Is it continuous or on and off?
It's just on and
Okay. Can you
off.
please point with one finger where exactly the pain is?
Just in my lower tummy.
Okay. Does it travel to anywhere else?
No, it doesn't.
Is it anything makes it better or anything makes it worse?
When I am with my husband, it makes it worse during intercourse.
Uh, oh, all right. I'm really sorry to hear that. So is it for the first time?
Yeah, it's happened for the first time.
Okay, all right. And from the nose, I can see that you're having some discharge down below. Can you please let me know the color of the discharge?
Yes,
I'm really sorry to ask these sensitive
it's
questions.
yellow. It's
Okay.
yellow.
So, okay. Is it continuous on and off?
Um, it's on and off.
Okay. How many pads do you need to use per day?
I just use panty liners.
Okay. Does it blood stained?
No, it's not blood stained.
Okay. And what is it thick or thin?
It's mucousy, so it's a bit
Okay,
thick.
all right. Any I can see from the onset that there is some itchiness, but is there any rash or ulcer down below?
No,
Do you have any fever or any tummy pain?
no.
What about your waterworks? Do you feel pain while passing urine?
Yes, it's been burning for the past few weeks as well.
All right. Is there any change or color of the color or smell of the urine?
No, no change.
Okay.
No,
How about your bowel habit?
my bowel habits are normal. They've not been affected.
Okay, I need to ask you a few more sensitive questions, but I'm really sorry to say that. But can you please tell me when was your last menstrual period?
My 10 days ago.
All right. Is it regular?
Yeah, it's regular.
Do you bleed in between the periods?
Yes, I do. I've started to bleed in between periods as well for the past month.
Okay, all right. I'm really sorry to hear that. And do you feel any excessive pain or excessive bleeding during your periods?
No.
Okay. So I'm going to ask you some sensitive question, but whatever we will discuss will be totally confidential. All right. Have you have you or your husband ever been diagnosed with sexually transmitted infection?
No.
Okay.
I don't
And
have a husband. He's a boyfriend. Sorry.
okay, all right. Do how many partners do you have for the last 6 months, especially?
I've changed twice.
Okay, all right. And do you practice safe sex?
What's that, doctor?
I'll discuss it discuss you with it later. But can you please tell me that have if you ever your partners ever been diagnosed with sexually transmitted infection?
No.
Okay. Okay. Do you think your partner having the similar symptoms?
No, he's not complained of any.
Okay. What type of contraceptive do you use?
We don't use anything.
Oh, all right. Do you have any previous history of pregnancies?
No,
Any history of miscarriage?
nope.
Is there any possibility that you can be pregnant?
No, I don't think so. I just had my periods 10 days ago.
Okay, okay. Are you regular with your pap test?
I've done that, I think, 6-7 months ago.
And what was the result?
It was normal.
Okay. Do you feel thirsty these days a lot?
No, not really. Go to your next task.
Okay, okay. Dear examiner, I'd like to know the general appearance of my patient. Is there any pallor, lymphadenopathy, or rash?
No.
What about the BMI and vitals of my patient?
BMI is 22 and vitals stable.
Okay, I'd like to do the focused abdominal examination. Is there any visible distension, any tenderness, or palpable mass?
No.
Okay. With the consent of the patient and the presence of chaperone, I would like to do the pelvic examination. On inspection, is there any discharge, any bleeding,
No.
any erythema, any scratch marks?
No.
On a speculum examination, is there any discharge, any bleeding, any erythema of the cervical wall?
There's mucopleural and vaginal discharge, moderate cervicitis with easily induced endocervical bleeding. Cervical os is red and inflamed and exudates a thick yellow discharge.
Okay. What about the bimanual examination? Any abnormality in cervical motion,
Time's up.
tenderness, or adnexal mass? Okay.
No. The rest of examination is normal.
Thank you so much for waiting for me, Jane. From the information you gave me and the physical examination I have done, most probably you have a condition called acute cervicitis due to chlamydia. Have you ever heard about it?
No, I haven't.
Okay, let me draw a picture for you. So this is your womb and this is the lower part of the womb. And what happened in this condition is that this is the inflammation of the cervix due to a bug called chlamydia trachomatis, transmitted through sexual activity. All right. These most of the cases these are asymptomatic, but in 75% cases, like, but sometimes it manifests as like mucopollulant or fishy vaginal discharge, itchiness, and there could be some pain during intercourse, pelvic pain, and there could be some other possibilities, like it can be due to bacterial vaginosis, but in that case the color of the discharge is grayish. It can be due to Trichomonas vaginalis, but in that case the vaginal discharge is green. It can be due to pelvic inflammatory disease, but you don't have any fever. So I'm guessing most probably it is acute cervicitis due to chlamydia. To rule out your condition, I've already taken the vaginal swab, but you might also give the first part urine, and I might also do the full sexually transmitted infection screening test, including nucleic acid amplification test. All right, are you with me so far?
Yes.
So okay, for now I'm going to give you azithromycin for 10 days, which is an antibiotic, and also I'm going to prescribe you doxycycline for 10 days and azithromycin single dose, and you need to avoid sexual intercourse throughout the treatment. And also I need to treat your partner as well, and we're going to discuss the safe sex, like you can always use a barrier method like condom. It will help you to protect you from sexually transmitted disease. Always wash yourself before and after say having sex, and wipe yourself from front to back, and maintain the proper hygiene. And it is a notifiable disease, so I need to notify the DHS, and also do the I'm going to do the contract testing for the past 6 months. Do you have any other queries?
No, I don't.
All right. Thank you so much. And please don't worry.
So
It
is
is
this
a
totally
manageable
curable?
condition. Yeah, it's totally curable, but there is a chance of recurrence. So I'm going to review you in 1 week with your result, and another I'm going to review it within 3 months and do a next test so that if I can check that is there any recurrence of the disease or not. All right.
Okay, that's fine.
Okay. Thank you so much. See you again.
Okay, thank you. Okay. Does everyone agree with her diagnosis? Ushi, is this your first time? Sorry if I don't pronounce your name properly, but is this your first time you're role playing?
Yes. Yes. This is first time.
Okay. I'll give you a feedback. I don't know. I really like interactive classes when everyone can participate and everyone gives their feedback. When I ask something, like I just ask everyone, does everyone agree with the diagnosis? And I have no response. Anyway, I'm not going to waste time. Your Okay, first of all, you got to the diagnosis and management and everything, but your biggest drawback was that you ran out of time. And you know the reason why you ran out of time? You took 5.5 minutes if I had not stopped you on history. Why your history was long? Because you're repeating everything which was said in the stem. You asked me my name. You asked me what problem I had. I already had dyspareunia and discharge, so you don't need to repeat the questions. Are you following?
All right. Yes.
Okay.
Yes, I
So
am.
just stick with your approach was good that you asked about abdominal pain. If she has any pain, any painkiller, any allergy to painkillers, and then just start. Okay, so Jane, you have the pain. I remember last week I taught you guys. Oopsie, Socrates or Odipara in the beginning. Take your history.
Yes.
Let me know if you can't see the screen, okay? Because now I'm going to write a few things. Um, remember to take a full detailed history, okay? And then your PEFE was fine. Investigations were okay as well. Coming to the diagnosis and management. Now, again, I'll repeat for you guys. Do not mention which antibiotic and how many days and what dose and whatever. Just say, I'm going to treat you with some antibiotics. Okay, so you don't need to go into the detail of what if you're going to give azithromycin or whatever you're going to give. Just say I will treat you with antibiotics. You gave good you got a good, like, I think one of the key points in this case would be notifying the DHS. So you did really well by mentioning that, and tracing partners, treating the partners, avoiding sexual intercourse until treatment. Okay. But when you discuss the most likely diagnosis, when you have, in my previous class, I know Daniel and Gakinima and Dr. Badal and a few of my old students would remember the 5 C's in diagnosis. Can anyone repeat what the 5 C's were? Whenever you explain a condition to a patient, what are the 5 C's? Let me see who's online because I'm not sure.
Hello, Daniel. This condition,
Yeah, I have a lot of old
condition.
students.
Hello, Daniel.
Yes. Yes,
Condition,
Daniel.
condition, common,
Yes.
commonly, complication, uh, condition, common complication, and
Cause and cure.
yes,
Okay, good. Okay. So you explain the condition. Look, you have a condition which we call as chlamydia, which is a sexually transmitted disease. It's basically a bug. Okay. So you've explained the condition and the cause. It is a common condition in sexually active, more common in the youngsters. So you've described commonality. Cure is we will treat you with antibiotics and complications. So you did not mention any complications. What's the most common complication of chlamydia? Anyone?
Pelvic inflammatory disease.
Yes, PID. Okay. And then PID leading to infertility and so on. So whenever you like, look there, you have a task, discuss the most likely diagnosis, you're going to be marked out of 7. So if you're just going to say you have chlamydia, okay, and you don't, and you just say, you just mention it was a sexually transmitted disease, but explain the full 5 C's, because you're going to be marked out of 7, and describe it in as layman terminology as you can. And management again means treatment and investigations. Okay, so you did well in that part, but again, as I said, don't mention which antibiotics and whatever, just say we'll give you antibiotics, and that includes medical treatment and non-medical. So non-medical can be the SNAP. I don't know if I taught you in the last few classes. So generally in all other common conditions, not in gynae as such. So no smoking, good nutrition, no alcohol, and good physical exercise. Okay, and non-medical management can be, like in this case, avoidance of sexual intercourse, using barrier methods, tracing of contacts, notifying DHS, etc., etc. So that's all non-pharmacological treatment, non-medical treatment. Okay, this is not to again, I'm going
Thank
to
you
say
so
whatever,
much.
if I give you guys a, if I give you a welcome, if I give you a feedback in which I am like um taking out all your drawbacks, or I'm giving you some negative remarks, it's only because AMC criteria to pass sometimes can be difficult, and unless you have managed time and said each and every important thing, they're not going to pass you. And it's like, I'm going to be very honest, sometimes AMC is very strict. They, even if you miss one thing, they may not pass you. It's a bit unpredictable as well. But at the same time, obviously, look, whatever we explain in the history, whatever the risk factors are, or if you don't describe the management protocol or whatever, if you're not going to say everything, obviously they're not going to mark you. So in that way, they are fair. But remember, you have to mention each and everything. That's why role play is so important. So in case you miss something this time, you won't miss it next time. Okay? Oshi, I hope you don't get demotivated. Okay? This is just a learning
No,
session,
no, it's really
and
good
we're
that
all here.
you're finding out my faults.
Yeah, for a
I'm really
first
thankful.
timer, I would say you did well. But look, because it's your first time, obviously you didn't know that so much information was already given in the STEM. Just don't repeat those things because it takes your time. So just work on your time management. Okay?
Yeah, thank you.
Welcome. Okay, let's quickly go through the slides so that we can go to the next case. Okay. So remember last time I taught you guys something for discharge? I think it can be used for discharge, bowel or urinary complaints, the CCVO, so color, consistency, volume, and odor. Okay, so for particular symptoms, we usually ask a set of history questions. Like for any symptom, we use ODPARA. I explained that last time: onset, duration, intensity, progression, associated factors, relieving and aggravating factors. For discharge, urinary complaints, and bowel complaints, we use CCVO. Some people find mnemonics much easier. That's how I find it. Even like in practical use, whenever I'm working in ED these days, whenever I have to take a history or something, I always remember my mnemonics and stuff and I apply it. So it may be helpful for some, and some people may not follow mnemonics, but I just try to help you guys as much as I can. So just going with the abdominal. Okay, so her first complaint was abdominal discomfort. So you ask her since when was it. If she says it's pain, go into the pain, like the Socrates of it. Then discharge, is it smelly, any pain, bleeding, itchy, rash, problem in waterworks, any burning sensation. Okay, so remember your CCVO: color, consistency, volume, odor, and then associated factors. So any pain with the discharge, any bleeding, any itchiness, any rash, problem in waterworks, and burning sensation. For discharge, you should have common conditions which are asked in the AMC. Okay, so if there is a vaginal discharge, it makes sense to ask you. And last time I told you guys as well, ask the well-being questions: sleep, appetite, uh, bowel, and bladder. Okay, so even if you don't think of urination association with chlamydia, if you ask the well-being questions, she would say, yes, I do have burning micturition. okay, which is a symptom in chlamydia. So once you've done with the history of presenting illness, which like look HOPI, you ask the history of presenting illness, then you go to the 5 Ps. So with 5 Ps, we do period, partner, pregnancy. It's very important. Pap smear, and what's the 5th one? Now I've forgotten as well. Pills. Okay. So what is important in chlamydia is that periods are, the patient may have regular periods but may have intermenstrual bleeding, which is a sign of chlamydia, which is a symptom of chlamydia, sorry. Okay. Partner, it's STD, so highly likely that they would give you something positive in the history that she's had multiple partners in the past few months. Okay. Pap smear, pregnancy don't really matter, but yeah, you can ask if she's had any pregnancy, any miscarriages, and when her last pap smear was. Pap smear is not important in acute thing, like in over a period of few months, but yes, years you have to ask her when was her last pap smear. In AMC, they may say, oh, cervical screening test. In AMC, they may tell you, oh, she's never had a cervical screening test. So then it's, and if she's, according to the new criteria, if she's above 25 years old, you have to arrange for cervical screening at this stage. Okay. And then pills, is she taking any pills for contraception? What type of pills she's taking? Um, I said she wasn't taking any pills. Different examiners can give you different findings. Um, okay, any awareness of STDs or any PIDs. Sorry, one thing you can ask in the presenting complaint is fever as well, because like with PID, you can have fever. If not mentioned, and a patient has similar presentation but without, if it's not given in the stem regarding deep penetration during intercourse, then you have to ask regarding her sexual activity, because if you have vaginal discharge, chlamydia is one of your differentials. So it can cause dyspareunia. Even like in candidiasis, you can have dyspareunia as well. Other medical conditions like diabetes, immunocompromised state, any medication she's on, ruling out candidiasis, as we discussed last time. How is her general health, her well-being, and SADMA, so smoking, alcohol, any illicit drugs she's using, any medication she's on, like medication she takes on a regular basis, and any medication on allergies. Okay. PEFE, so we do general examination with the BMI, vitals, and abdomen. If she's got lower abdominal discomfort, just do quick abdominal examination and just say, is there any distension in the lower abdomen, any what do you call it, any distension, any tenderness, any iliac fossa tenderness, like right or left iliac fossa. Okay. Because with the discharge you do have to rule out PID. Then the PV, the pelvic examination is more important. So obviously on inspection you have to ask, is there any bleeding, any discharge, any scratch marks, any ulcerations, any genital warts, any genital any genital warts. Then speculum examination, you have to ask for the health of the vaginal walls, the cervix. Is there any inflammation? Is there any discharge? What does the cervix look like? Okay. If there is discharge, what color discharge is there? So at times they can give you that there is some sort of inflamed cervix, and there is a yellowish discharge, and cervix is easily induced, like this easily induced endocervical bleeding. One thing you forgot to okay, and then you can finish your bimanual examination by asking just the uterine tenderness or maybe adnexal mass tenderness. That's it, but they're not relevant unless she's had any iliac fossa pain or any iliac fossa tenderness. Then you have to do bimanual. If you don't do bimanual in this one, it's okay because she's got lower abdominal discomfort. It's not in the iliac fossas. You did forget the office test, which is the BSL urine dipstick and UPT. Oshi, are you listening?
Yes, I'm listening.
You
Yeah,
forgot the office
I
tests.
missed that. Yeah, yeah.
Okay. Okay, diagnosis. Okay, with the history that she gives, look, remember I told you last time as well how to study. Um, take out the topic of chlamydia. There's a very good website, I think healthline.com.au or something, healthline.com. If you just type in chlamydia, it will give you symptoms of it, it will give you signs of it, different in women and men, and it'll tell you how to treat it and home remedies and what tests you do and whatever, etc., etc. So I studied it from there. So if you open up Healthline and type in chlamydia and go to symptoms, you will actually have a list of symptoms that the patient usually has. So they have dyspareunia, they have vaginal discharge, burning urination, pain in lower abdomen, and bleeding between periods. Okay, on examination, there is inflammation on the cervix. So if all of these are present, it's highly likely that is chlamydia. Okay. Other differential diagnoses you can give that it can be gonorrhea or bacterial vaginosis or mycoplasma or trichomonas or candidiasis, but it is unlikely in your case because of the type of discharge, the history of your change of sexual partner, um, burning maturation with dyspareunia, um, and the appearance of the cervix on examination. All of these point towards chlamydia. Okay, so then you explain chlamydia is a sexually transmitted disease. It is a bug, which is sexually transmitted from one person to another during intercourse. Okay, so you explain the cause. It is very common in young adults. So that's commonality. You've explained the condition. How to cure it? Well, first we need to do some investigations. So we do first pass urine. Okay, we will take a urine sample, send it for PCR. We'll take endocervical swabs, full STI screening. Remember, okay, this is another critical error people make. When you have um, when you're going to like you've diagnosed it as chlamydia, right? You're not only going to test her for chlamydia, but you're going to do a full STI screening. And then if you want to be more specific, you can say we're going to do a NAT test, which is a nucleic acid amplification test. Treatment is with antibiotics. We will give you some antibiotics. Treat the partner, abstinence or condom use during treatment, and notify DHS because chlamydia is a notifiable disease. Okay, so you've covered the cure in the 5 C's as well. And then the last C is the complications. If we do not treat this at this time, you can end up having a pelvic inflammatory disease, which means that the infection spreads into your whole reproductive tract. This can cause pelvic adhesions, chronic pelvic pain. It can cause infertility and ectopic pregnancy. Um, and the longer duration you have it for, the more discomfort you would have. So it's essential to treat it at this stage. So does anybody, well, I can see there's already some questions there, but everyone understood up till now? Okay, good. We need to mention risk factors. Yes, you do need to mention risk factors. Risk factors in manage is covered in management. So abstain from uh, sexual activity. Okay, so that is a risk factor. You've already explained it. Can we do PV examination for discharge scenario? Yes, you can. When we should not do bioman exam, I mean, like when you're not spreading the infection. That's a bit of a controversy, Arman, whether we should do bimanual examination or not. There are some contraindications for bimanual examination, like in prom, you definitely should not do a bimanual examination. In discharge cases, you can do a bimanual, because like in this case, you have to like if this was like a PID sort of a case, in which a patient has lower abdominal pain, more in the iliac fossils with discharge and fever, and she's sexually active and you're suspecting PID, then obviously you do need to do a full bimanual examination. Okay, so this is a chart for a few, I don't remember where I got this from, but like say, look, bacterial vaginosis, symptoms and sign is gray, thin, fishy smelling discharge, often with prurite and pain. Okay, pruritus and irritation, no dyspareunia. Okay, criteria for diagnosis is 3 of the following. So gray discharge, pH more than 4.5, fishy odor, and clue cells. This is the AMC's criteria. Okay, I think this, if I'm not wrong, oopsie, I don't know how to exit this. Examination under microscope will show clue cells, decreased lactobacilli, increased coccolobacilli. Differential diagnosis can be trichomoral vaginitis. For candidal vaginitis, for like candida, it's thick white discharge, burning micturition, there's a lot of pruritus, and it's more curdy-like, okay? And it's like a yeast inflammation under potassium hydroxide. You can see the yeast cells. Trichomoral vaginitis, profuse malodorous, yellow-green, dysuria, dyspareunia, and erythema. Identification, okay. Under the microscope, you'll see flagellated protozoa and increased polymorph PMNs. I forgot what PMN is. Totally out of my mind at the moment. Inflammatory vaginitis, just as simply vaginitis, purulent discharge, vaginal dryness, thinning, dyspareunia, dysuria. It's more common in postmenopausal women. Again, the pH is it's more alkalinic, okay, towards alkaline. Increased PMNLs, parabasal cells, cocci, decreased bacilli. And differential diagnosis will be erosive lichen planus. Lichen planus is more common in postmenopausal women. Farwa, I don't get your question.
I would like to ask, like, no, for the Socrates, right? There's the radiating factor, and then the character of the pain. Do we need to say all that, like where it radiates, the type of pain, and the onset of pain? Because just now when she was saying about all the pains, I think it took time there, so I'm not sure if all is required.
Sometimes the history taking can be long. That is up to you, how you can concise it. It doesn't take that long. Okay, if somebody has abdominal pain, okay, can you tell me where is the pain? Point it with the finger. How did it start? So that's the onset. What type of a pain is it? That's the characteristic. Is it crampy? Is it dull? Is it colicky? Okay, then does it radiate anyway? Does it travel anyway? Do you have any nausea, vomiting, fever, any urinary symptoms or bowel symptoms with it? That's your.
Oh, okay, thank you.
Timing, is it constantly there? Does it come and go? Is there any big time? Then does anything make it better? Anything make it worse? It doesn't take more than a minute. Farwa, I don't understand your question. Obviously, you're supposed to ask the symptom from the patient, but whatever is mentioned in this scenario, just don't repeat it. Just say, okay, from the notes, I understand that you have some lower discomfort and you have some discharge, which is causing painful intercourse. So can you tell me more about the discharge? What is the color? What is the consistency? What is the volume? What is the, is there any smell to it? Is there any odor to it? Okay, then you can say, what else was given in this STEM? Yes, so this was given in this STEM. So you just confirm it like that, but don't ask it. Answering and questioning and answering will take more time than confirming the details. Welcome. Okay, who's next? I think Arman was next. Arman, were you next?
Yes, ma'am. Yeah.